Welcome to the She Found Motherhood podcast. Today we are lucky enough to have Sam and Megan, two physiotherapists who are from Island Kids Physio, with us talking about plagiocephaly. They treat babies through to 18-year-olds and they want to make physiotherapy fun. They've got an amazing facility, even with a climbing wall in it, just across from Uptown above Island Ultrasound. If you're postpartum and you're finding you need a little bit more information and support, check out our Pregnancy Posse. It is a support group, a membership site that we have monthly Q&As with experts, and we talk about everything that you want to know about. Check it out on our website at www.shefoundhealth.ca. We'll get to our chat with Megan and Sam right after this. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. All right, Megan and Sam, thank you so much for joining us today on the She Found Motherhood podcast. We are talking about plagiocephaly. So do one of you mind telling us a little bit about what that is?
So this is Megan. Sorry if you guys want to figure out whose voice is talking. Plagiocephaly is a flattening. Plagiocephaly specifically on one side of a baby's head. So we often hear kind of blanket term as plagiocephaly. There's actually two kinds. Plagiocephaly would be one side or the other, and a brachycephaly would be the straight across the back flat. On a baby. And this can be a result of positioning in utero or positioning afterwards. And it can also be contributed to by a torticollis, so a tightening in one of it's called the sternocleidomastoid muscles. It's a neck muscle in the baby, again, often because of in utero positioning.
So when you say in utero positioning, do you mean the position that the baby is actually hanging out when they're in your uterus? Because they're pretty cramped up there, right? Mm-hmm. So that would be kind of pressure from the uterine wall on one side of the head or the other, or they're just in the same position for a while so that neck muscle doesn't kind of stretch out as much as the other side. Is that what you mean by the in utero positioning?
Yes, correct. Yeah,
awesome.
Absolutely.
And then the out of utero positioning, so the post-birth positioning. Let's talk about that a little bit more, Sam. What do you mean by that in terms of kind of that positional plagiocephaly?
I think with that, it comes down to in those first few weeks and months of baby's life, they spend an awful lot of time on their back. And with that, they have very soft heads in the beginning. So when we are, changing their diapers, or when we're putting them to sleep, or when we're putting them down, or in the stroller, they are always on the same part of their heads, even in the car seat a little bit as well. And so what we mean by that is afterwards, sometimes they can kind of get a bit of a flat spot there as well. And then what happens is they find a preference. So when they're when they're on their back and they're starting to get that little bit of a flat spot there, they find that spot and they stay there. And then it just becomes a little bit of a cycle, and it can get a little bit worse there as well. And I think that definitely is because we are all told back is best, right? So we pop baby on their back. That's really important then to kind of see what we're doing throughout the day as well. And that's when things like tummy time and carrying and things like that come in as well.
And we are all creatures of habits. It's funny, I never really thought about this when I had my kids, but as I have more and more babies coming through my practice and the parents are always asking me about kind of the flat spots on their heads, I've come to realize that we always put our babies down the same way. When we change their diaper, we always put them the same way. Put them in the crib, we always put them the same way. And our babies want to look at us. We are their source of stimulation. So they will always look the same direction. So I've certainly started telling parents to kind of just alternate the sides, which is awkward when you start doing it, but you get used to it, just so that they look the opposite direction sometimes.
That's perfect advice.
It is. And parents are so dominant. I am very right-handed. And so you put baby down the same way. It's very odd to think, oh, let me change sides and let me try and twist myself to put baby down so they look the opposite way. And that's a lot of advice we give, isn't it, Megan, on kind of feeding, positioning, and also diaper change and positioning as well.
So
Yeah,
we've kind of talked
absolutely.
about that positioning, but let's talk, you mentioned it, kind of tummy time. Do you guys mind chatting a little bit about tummy time?
We
Sure,
love chatting about tummy time. And we love talking about tummy time because there's a huge amount of benefits, and we could go into that at another time, but I'm going to talk to it specifically today about for prevention of the plagiocephaly, the flatheads. So with the massively successful Back to Sleep campaign, what that meant was babies were safer sleeping, and that's fantastic. But it did mean that babies were spending a lot more time on their backs because they're sleeping all night on their backs, as they should. That's the safe option. However, because of that, we needed to make sure that babies weren't developing these flat spot, and that's where kind of this big push for tummy time came from. So if babies are spending, their sleeping hours on their back, then we really want to encourage them to spend lots of waking hours on their tummy. And again, lots of developmental benefits for that, but specifically for preventing that flat spot. If a baby's on their tummy, they're not lying on the back of their head, which means they are not putting pressure on the back of their head. Questions about tummy time, because what it might look like and how we can help moms say, my baby hates tummy time.
That's what I was just going to ask.
Yes.
So many people come in, my baby hates tummy time. They cry all the time. How do I do this?
Absolutely.
So do you have a couple of hot tips?
Absolutely. I think tummy time on you. Like you said, and like we've spoken about, babies want to see your face. They react to our voices. So baby, lying them on you is just the same. When we think of tummy time, I think people think on the floor, flat on their belly, head can't move. And that's really not what we want to kind of promote these days. It's tummy time, any positioning on you, over your legs even, so they can kind of see around a little bit and, encourage that head movement and lifting that head over your leg as well. So I think there's lots of different ways that are really good now to encourage that tummy time. And yeah.
And also wearing a baby in a wrap or a carrier is wonderful tummy time for the purpose of being off their head and learning to control their neck, because they're going to look up at you. So you want to go for a walk with baby in a sling, a wrap, a carrier. You can count that towards your tummy time totals for the day as well.
And where Megan says tummy time totals, we don't expect babies to be on their belly for a whole hour at a time. If you do a minute, 2 minutes, great. Add that up over your day, and then you probably are hitting the hour. I know with my little one in the beginning, he was not a fan. And I used to kind of just titrate it up, and he started at like a minute or two just on me or on dad. And then you can kind of work it up into a bit of playtime there and extend that. But when you look at how many times you pop them on their belly over the day, it can then add up to an hour. So we'd never kind of say, oh, go and put baby on their tummy for a whole hour. Because no, not any little one's going to enjoy that at all.
It's like any strength training routine. You got to start small and then slowly build your strength up. So those are great tips. So when we're talking about plagiocephaly, so what does it actually look like? So when you have a kid come into your clinic, what are you looking for to determine the severity or the diagnosis of plagiocephaly?
I can start with a couple of things. When we first see baby come in, we definitely look at any kind of ear shift. So those ears level, any facial asymmetries that we can see straight away, and kind of where that flat spot is. It's not always in the same place. Sometimes, as Megan said in the beginning, it can be on one side, it can be in the middle, it can be on the other side, more to one side. So I think definitely as they first come in, that's something we look at.
And then if we felt that it was a more severe and warranted measurement, we have a couple kind of fancy types of measurements that we do. We would use calipers, or sometimes those of us who've done it a lot will eyeball it because we've seen enough of them.
Yeah.
But we have it's CV, cranial vault asymmetry index. Look at me, I remembered it.
Wow.
It's just a measurement where we measure on the diagonals and we can do a calculation. And what that gives us is a value of, okay, is conservative management, positioning, stretching enough, or do we need to go a little further down and start thinking about a possible helmet? And we have some really good research and data that tells us at a certain CVAI that we might want to head down that route. Generally, though, we're not seeing the really severe. If we get them young enough, and parents are coming in early and recognizing that, often positioning and stretching is enough to help prevent the need for helmets.
Awesome. And you've talked about stretching. So do you mind kind of describing kind of the torticollis and what you're looking for in that? How do you determine if that is a component of the plagiocephaly or not?
I think that's definitely when you're looking at babies. So kind of mum or dad popping baby down and seeing where they naturally lie. And so it tends to be obviously to one side or the other, and the flat spot tends to be there because it's their preferred side. And so we go through stretching to gently stretch over to the opposite side. And also in lots of different positions. So again, we're not just always moving baby's head, it's how you're positioning your baby as well. So turning them out to the front in kind of like a side lie position to encourage that kind of lateral movement. And again, kind of that tummy time positioning as well. But we really go through teaching parents how to handle that as well, and how to kind of move those babies into those stretch positions as well, and what we're feeling for there as well.
Yes, and we always want to look for severity on the torticollis. So we look for how much tilt they have. It might be a little bit, it might be more significant. When a torticollis has progressed to a pretty severe, we're looking for almost a nodule that forms in the muscle. And if it's at that severity, again, then there might be more aggressive intervention we might do. But again, we would almost never start with anything but just trying the stretching routine. We can also use a really great baby reflex. That's the lateral riding reflex. So simply by tilting baby in one direction, they have a reflex where they want to keep their eyes level with the horizon. And we can use that reflex and practice tilting baby one way, and the reflex will help bring their head back the other side to work on strengthening that weaker side.
Babies are so fascinating, really. They have all these like reflexes they're born with just to survive. It's crazy, hey? So one question that we often get, not often, so one question we sometimes get is will it affect my baby's brain development? So will plagiocephaly, positional plagiocephaly, affect my baby's brain development?
I can go. The answer is no. I mean, I would say that it won't. It's for the most part, and again, there's the very severe cases, but these are usually due to something else than just the positional piece. No, it's mostly, honestly, cosmetic. When the forehead or the cheek or the ear starts to shift forward, there can be some asymmetry in eyes. It can affect vision, that sort of thing. But the most of the positional plagiocephalies we see, we're treating it for more the cosmetics and making sure that, again, because of that flat spot, they're not developing weakness or tightness in one side of the neck or the other. So no, their brains are okay. It just looks flat.
And I think that question comes up when people have been using the old Google, and I have come across craniosynostosis, which is a fusing of the actual skull plates together inappropriately. So this is totally separate from that, but that is kind of a question that people come up with after they've done their Google searches around their baby's head shapes.
Yeah, absolutely.
Absolutely.
So in terms of treatment, do you often see, once you've kind of instituted these stretching and positional treatments, like an improvement? And what does that look like? And what kind of time frame do you usually recommend people doing these kind of stretching and positional before reassessment, or before you would notice like a significant improvement?
I think it definitely depends on the severity, but we're going to talk on kind of like the mild cases. It still is kind of a couple of months, definitely, because baby's got to form that head into different positions as well. So I think we always give them stretches and positional play and things, and kind of check in kind of like 3 to 4 weeks. So give them time to see any changes there, and then reassess at that kind of 1 month. And then again, if there's nothing else, re-change some of those stretches, encourage more positioning because they tend to get much more confident in tummy time by that point, and then reassess again in maybe 3 to 4 weeks.
Yeah, and I always tell students and new physios, and of course parents, that we expect to see changes in range of motion, like a preference to turn their non-preferred direction, less of a tilt, all those things. We'd expect those changes to be observed much more quickly than the actual shape of the skull. So I always tell parents what I'm looking for at my first follow-up in 3 weeks to 4 weeks is that they have changed their preference. They're not as tight in their neck. Those are all I would say positive. And bonus if their head's already starting to look better, but likely it will be several months until the head fully reshapes. And again, we take advantage of the fact that those sutures haven't fused yet, for 18 months, 2 years. And so to know that the head will sort itself out, but we're looking for the other changes much sooner than the actual head shape.
I was just going to say the earlier that we detect it, or the earlier that we start treatment, is always better.
And then most kids are starting to kind of sit up supported at that 4 to 6 months mark. Do you find that that's like a pretty significant milestone that will help improve that?
Absolutely, because then they can take that pressure. They're not spending so much time on their back then. So they're naturally taking the pressure off their head then. And we definitely see a big change at that point.
Absolutely. As long as they've been pulled out of any sort of sleep position or like a DockATot, et cetera, by that age as well.
Oh, the DockATot. That was not around when I had children. That's a whole other conversation.
Yes.
Yeah.
Perfect. Anything else that you want parents, caregivers to know about positional plagiocephaly?
I think the big one is the reassurance that, first of all, it's better to get it checked. If you're like, I don't want to be that parent that is worried. As we say, the earlier we can treat it, the easier, the simpler, the fewer visits usually, if we get it early. So don't feel like you're that parent. If you want to get it checked out, just get it checked out. And it may be, they're fine. Or it may be, let's try this positioning technique and they're good to go. So I'd say just your baby's going to be okay. But trust your instincts that if you feel like something's going on, because the earlier we can treat it, the better.
And I think it's also important to remember that we've talked about giving, stretches and positioning tips and things like that. And life can already feel very busy when new mums and dads. And I think, it's important to say our expectation is that you don't do that every single hour or throughout the day. And that, any advice that we give or any health professionals give on that is that, again, building it up, starting once a day and then building it up from there and kind of fitting into your routine that you find naturally with your baby as well. I think that's a really good thing.
So you guys are both physios and both have children. Did any of your children have positional plagiocephaly?
2 of our children had a little flat spot, didn't they, Megan? Which is quite funny because I had my little one in April of this year, and we reopened the clinic after COVID in May, and we were sitting in the clinic just kind of getting it ready, and I was like, Megan, he's got a flat spot. It's definitely a flat spot on this head. And I don't understand because we've been doing tummy time and all these things. And Megan looked and she's like, yeah, there's a slight flat spot there for sure. And that I think is really, it just happens, right? Even if baby's doing tummy time and things like that, it is not just that you have had baby lying on their back for, lots of time and not on tummy time. It can happen whenever, but even just from being in the stroller on long walks and things like that. So I think definitely it's interesting that, it's not just, kind of because of that uterine position or because they've been on their back so much, it can happen in those strollers and different things as well.
So the experts are telling you,
yes,
it's not your fault.
No,
exactly.
It just happens.
My husband made fun of me with my daughter because her 6 weeks old is like, she's only looking to the right. She prefers the right. She always sleeps with her head to the right. And he was like, she's okay. I'm like, no, we have to do this. Got right on the positioning.
We are hilarious with this, that's for sure.
But it's so interesting, right? I think as mothers, the mother guilt, the mom guilt, the parent guilt, I'm sure the dads have it too. It's pretty incredible. But these things, they happen and they're not abnormal, but we can help improve them. And so it's really important to kind of ask for help when you need it and really not take it on yourself because it's just a normal part of development for a lot of kiddos. And they get through it and we get through it and most of them are fine. And as I say to some people, that's what hair is for.
Oh.
Exactly.
Exactly.
No, you're doing a great job. If your baby has a flat spot, it's because your baby has a flat spot. It's not because of anything you did.
And also sometimes babies have like heads that have a bit of a flat spot on at the top, right? Sometimes it is just the way they were made.
So I have a question for you guys. We're asking our podcast guests if you guys feel comfortable. We are trying to normalize postpartum experiences because it's wonderful and a challenge for many, many parents. So I'm curious if you guys feel comfortable telling me what your fondest memory of the early postpartum experience was and what your biggest challenge was. Sam, why don't you go first? Since it's more recent in your brain.
Absolutely. So my baby boy was born in April of 2020. So I think the biggest challenge most definitely was COVID, because it was the beginning stages of COVID. And I think just having kind of 3 weeks to change our postpartum plan that, you know, everyone says you need your plan. And then in 3 weeks, it's like, okay, we don't have a plan anymore. And kind of, you know, finding a new way through that and having coffee delivered to the door and shopping delivered to the door and things like that, which we didn't think would happen. So that was definitely a challenge that was a good thing. But I think leading from that, the benefit of that is that my partner was able to work from home. So for the first 8 weeks of my little boy's life, it was both of us. And I think my fondest memory is him being on his dad in the wrap and his dad working on his computer and baby just sleeping in his wrap. And it was great because then I could go and sleep. So definitely that was a great memory of mine for sure.
So lovely. What about you, Megan?
I would say, so I have a 4-year-old and a 2-year-old, so it's a little bit further away. But I would say for both of my babies, my fondest memories are those just some of those early days. They're also kind of a fog, but just I really tried, and I do have wonderful family support, to kind of just be with my baby and that time together, just snuggling up. I work with babies and kids. I love them. So just being able to really enjoy my 2 little ones when they were so young, and just really trying to spend that time. And my husband was wonderful support, where I could just enjoy them and sit and snuggle and feel no guilt about sitting and snuggling with them. And I would say the most challenging, for my first especially, it was that extreme just decision fatigue from constantly feeling like you're making so many decisions and they all feel like they're the most important decision you've ever made and you've never made them before. And I found myself, that was a big adjustment with my first, is just feeling exhausted from making all these, what I felt like micro decisions, but they were giant in my brain. And so that was definitely a big adjustment and definitely a big challenge for me.
Yeah, I hear you on that. And then the second one, you're like, why did I worry so much?
Like, they're fine.
They're fine. They'll be fine. They have a bit of a flat spot. No worries.
They'll survive.
It's all good. How can people get a hold of you guys? Where can they find you?
So we are Kids Physio Victoria, or on Instagram and Facebook, we are Island Kids Physio. And we are located right opposite Uptown Mall, above Island Ultrasound, which many of us have been to. And we can be found by phone. So our phone number is 250-590-1033. Or you can give us an email if you have any questions on anything that Megan and I have said today, which is victoria@kidsphysio.ca.
Cool.
Yeah, and feel free to DM us on Instagram, even if that's the easiest way. Sometimes nursing and Instagram is the fastest way to get a hold. So I run our Instagram account, and feel free to DM me and I'll make sure to direct you to where you need to be.
And if people want to access your care for their kiddos, do they need a referral for a doctor, or can they just give you guys a shout?
Nope, they don't need a referral, not unless their extended health benefits require it. And there's very few, I think some military and veterans benefits do require it, but otherwise you can access us directly. Obviously, make sure to check your extended health. We do direct bill extended health. We'd love to be able to use that for families if you do have that resource.
And you guys provide care, I was just learning, up and down the island virtually now.
Yes.
Yeah, which is great.
Awesome.
That's definitely a benefit.
Well, thank you guys so much for coming. I'm excited for our next podcast together on maybe milestones or baby wearing techniques. So many options.
Awesome. It was great to talk to you, Alicia. Thank you.
Have a great day. And we will post all of your info on our show notes so people can get a hold of you.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.